And now the answer to tonight's On the Money Extra question. How much do Americans spend annually on diet products? $40 billion. More than 71 million people in the U.S. begin a diet each year. Well, this is one of the most popular stories that we've run on this show. Lots of emails asking for more information. So by popular demand, imagine losing an inch of belly fat during your lunch hour without dieting or going to the gym. NBC's Tom Aspel on The Money tonight from Tel Aviv.
There's a huge market in fat busting. Studies say in America alone, 130 million people are willing to pay money to lose weight.
Change?
Liposuction can remove fat for about $3,000, but it's invasive surgery. It hurts. It has health risks. Or there are diets, pills, but not everyone has the willpower to cut back on the foods they like. What about doing it the hard way?
Losing fat from the body can be done by exercising, but it takes time and requires quite a bit of effort. The basic idea is to take fat from some areas of the body and turn it into muscle in other areas.
And now we mark the area for treatment.
Now there's an easy way to do it.
Now you can lie down.
Blast fat cells away with ultrasound. An Israeli company, UltraShape, has taken fat removal out of the operating room and into the doctor's office.
Everything is marked here.
It expects to get FDA approval soon for a machine that will take off nearly an inch of fat in a single session, painlessly, maybe over the lunch hour. UltraShape focuses on thighs and the abdomen, plots an exact area of unwanted flab, and the ultrasound smashes the membranes of fat cells beneath the skin. The body dissipates them naturally, like clearing out damaged tissue from a bruise. UltraShape has already sold its invention to clinics in Europe, the Mideast and Asia, 60 machines at $120,000 apiece, and treated 1,000 patients for about $3,000 each. It's surprisingly popular with men trying to get in shape discreetly.
Obviously, it doesn't have any stigma of a cosmetic surgery. No one even knows that you have undergone a cosmetic procedure for fat reduction.
Ultrasound spot reduction won't do cellulite, but UltraShape is working on it.
We have a designated transducer for the cellulite, and we need to try it in clinical trials. It will work in cellulite in the future.
The company has spent $10 million developing and marketing its machine with disposable heads, taking aim at the American market, where a third of the population really wants to lose weight to look better. Tom Aspel, NBC News, Tel Aviv.
With us tonight, got Bob Gerberich, president of UltraShape North America, and Dr. Stephen Teitelbaum, plastic surgeon who has conducted clinical trials with UltraShape's device. Doctor, I'm going to start with you. We have some sense in the report there as to how this works, but walk us through the science of it. What is it doing? Are there any potential risks? What are you looking for in the clinical trials, doctor?
The most important thing that people realize is this still has not even been processed through the FDA. So we're probably a year away from this being available in the United States. So viewers should treat this as science fiction. When it's finally available, they'll find out about it. In terms of how it works, a patient simply lies down. This transducer that gives the ultrasound energy is put on the outside, and it permanently destroys fat cells. We did a very intensive clinical trial measuring every conceivable blood test and liver test. There was no pain and there was no side effects, and everybody enjoyed some small amount of permanent fat removal.
How does it destroy those cells?
What it does is, if you think about a diagnostic ultrasound like a woman might get when she's pregnant, there's a transducer that shoots parallel beams of ultrasonic energy. What they did is they made a dome transducer so the beams all converge at a single point. And at that point, there's a lot of energy, and that's enough to burst those fat cells beneath the skin surface.
And then it just gets flushed out of the system once it's broken? Is that what happens?
Exactly. It gets flushed out of the system. But the important thing to remember is viewers should not confuse this with losing weight or even with liposuction. Some of the people you showed in the B-roll at the beginning show quite overweight people. This is not for that kind of person. This will never replace weight loss. This is for removing small areas of disharmony, incongruity, for instance, a little bulge on the outer thigh, a bulge in the love handles, but it's not going to substitute for weight loss. It should not be oversold. It is for body contouring at a small level.
Is that a fair characterization in your mind, Mr. Gerberich?
Yes, it is. It's very fair. This is definitely not a replacement for liposuction. It's rather a non-invasive alternative for those patients not willing, ready, or able to go through surgery that are really looking to reduce localized fat deposits, as Dr. Teitelbaum said, in the abdomen, love handles, and thighs. And a physician can truly yield a new body image and body shape with this technology, but there are moderate changes.
Mr. Gerberich, A, is the doctor's estimation of being roughly a year away from being in the U.S. market accurate, and B, or is that what you're expecting, I should say, and B, how much do you envision this procedure costing?
Yeah, well, we have completed, as Dr. Teitelbaum was part of, a worldwide multi-center clinical study. So we feel very confident in the safety and efficacy of this technology. We are currently in discussions with the FDA. We're very pleased with the progress that we're making, and we're confident that we'll receive the clearance of our Contour One technology. With regards to the timing of this, I don't want to speculate as far as the timing goes with the FDA at this point.
What about the pricing?
With regard to the cost, that is determined by the physicians and their practices overseas, where the device is currently being commercially used. The procedure fee ranges from $1,000 to $1,500 per treatment, and within our clinical study, we did a single treatment which yielded a definite measurable change in circumferential reduction. But we anticipate 2 to 3 treatments most likely yielding optimal results with this technology.
What countries is it commercially available in now?
It's largely available in almost 30 countries worldwide. Europe, Asia, Africa are our primary locations.
And real quick, I got 2 more questions. What do you think the U.S. market is worth to you if you get the FDA approval?
Excellent question. Obviously, we believe it's a tremendous market. If it means anything, surgical liposuction is the #1 aesthetic surgical procedure in the United States and across the world. And that looks to be about 500,000 patients annually. We estimate, as was stated earlier in the broadcast, that the market for an ultra-shape type procedure is in the hundreds of millions.
Okay. And then finally to you, Dr. Teitelbaum, can you envision any other application of this type of technology beyond fat reduction? Could you use this for a more directly life-related medical procedure, breaking up clots or anything like this?
Ultrasound has been used for a lot of things in the human body. It started for doing cataract surgery, and it's used for hundreds of different purposes already in the body. So this is just one more use of ultrasound in the human body.
All right. Great to have both of you with us. Thank you, gentlemen.
Thank you.
Thank you.